Pressure in massage is way more complicated than most people think. And it's not just about going deeper or going lighter. A lot of the conversation for years now has moved between either deep pressure is harmful or if it doesn't hurt, then it's not working. And both of those are just really oversimplified. So for starters, deep doesn't always mean firm. You can have a deep massage experience without there being a lot of firm pressure. Deep is more of a subjective word than it is an objective type of pressure experience. But beyond that, there's something called pain gate control theory. And basically your nervous system has this filtering system in your spinal cord. So when we apply pressure, especially like non-painful feel-good pressure, we're stimulating large sensory fibers that can actually compete with pain signals that are traveling to the brain. So in very simple terms, sometimes pleasant, non-aggressive massage can turn down the volume on pain. And that's why, like when you rub your elbow after you bump it, it can actually really help with the pain. It's not that you're fixing the tissue, you're influencing the nervous system. And then on the other end of the coin, you have something called diffuse noxious inhibitory control. And that's just a fancy way of saying that pain inhibits pain. When the body experiences a controlled, tolerable, strong, or firm sensation, the brain can release endogenous opioids and other inhibitory chemicals that reduce pain perception in other areas. So that's why for some people, firm pressure can actually feel super, super relieving. It's not because we're breaking up the scar tissue and we're changing the tissue. It's because we're triggering an actual nervous system response. But then there's nuance here. Those systems only work when the pressure stays within the client's tolerance. So if someone is clenching their jaw and holding their breath and really bracing their body in response to the pressure, we've probably crossed from therapeutic into that threat response. And for some nervous systems, light pressure is super regulating, while others, the firm pressure is really grounding and safe. It just depends on the person and on their history, their stress levels, and ultimately their pain sensitivity. So what I think we need to talk about is how pressure should never be about our own egos as massage therapists. It's not about how strong you are and how firm you can apply pressure. And on the flip side, it's also not about trying to convince every client that lighter pressure is superior or better. It's about understanding that nervous systems are going to respond differently and trying to create the response that is best for your client. So the best massage therapists are going to listen to their clients to understand them, their goals, and how their nervous system is going to respond best to the pressure that they are going to be applying. And if you're a massage therapist, make sure you share your thoughts in the comments and follow our page for all things massage, technique, and business growth.